Now, as the deadly Ebola virus continues to ravage some parts of West Africa, health ministers from 11 African countries are meeting in Accra, Ghana, in an attempt to try to contain the deadly and worsening outbreak. So far, 763 people have been infected with the virus. 468 of them have died. Most of the cases have been in Guinea, where the outbreak started. But it has since spread to Liberia and Sierra Leone and is now the biggest and most deadly Ebola outbreak the world has seen. Health officials from those countries, as well as Côte d'Ivoire, the DRC, Gambia, Ghana, Guinea, Bissau, Mali, Senegal, and Uganda, are attending the meeting.
In eastern Sierra Leone, health workers at a local hospital in the town of Kenema suit up in protective gear to treat patients suffering from the deadly Ebola virus. But they know not all Ebola-positive residents are coming to receive the treatment they need. At Kenema Government Hospital's isolation ward, officials say the patients have both a fear and misunderstanding of how the hospital treats Ebola victims.
My biggest problem as it stands now is getting the people to still accept the disease. People should understand that immediately somebody presents with diarrhea and vomiting, they should report to the hospital immediately.
Authorities in the country are struggling to contain the spread of Ebola, which broke out in the east of Sierra Leone last month after first being reported in neighboring Guinea in February. The outbreak in Guinea, Sierra Leone and Liberia has left some of the world's poorest states with porous borders and weak health systems undermined by war and misrule, grappling with one of the most lethal and contagious diseases on the planet. Ebola causes fever, vomiting, bleeding and diarrhea and can kill up to 90% of those it infects. Highly contagious, it is transmitted through contact with the blood or other fluids of infected people or animals. The outbreak is already the deadliest since Ebola first emerged in Central Africa in 1976, and the number of infections continues to rise. Despite efforts by national health authorities and international aid organizations to contain the spread of Ebola, the World Health Organization has recorded over 700 infections, including 400 deaths, in Guinea, Sierra Leone and Liberia since the outbreak began in February.